physiotherapy. In episode 1, we took a look at some common things I'll do to assess and kind of evaluate the rotator cuff, which included a lot pertaining to scapulothoracic, thoracic spine, and the hip. We've talked about in terms of the scapula, right scapula here facing you, will glide up and down. It'll glide, translate in and out, kind of up and away, kind of down and in. We talked about how it tilts back, tilts forward, rotates up and away, and then kind of down and in. We also talked about how it externally rotates and how it internally rotates. So we've got a combination of a lot of different things taking place that we need in conjunction with the thoracic spine to function well in order to have a good, healthy rotator cuff. So with regards to that, we know that when we take a look at the model of the spine, and we have so the rib cage isn't on here, but when we do have the rib cage there, what the thoracic spine does, the scapula will do in terms of tilting forward and backwards, its rotation and with its side bend. And so they feed off of each other. The scapula can affect the thoracic spine because of what's going on at the shoulder and elsewhere, and vice versa, the hips and thoracic spine can affect the position and the functional mobility, stability of the scapula. It's the left scapula that we're actually taking a look at here. And so most important thing before I do anything else, I'll look at hip function. So I'll blast through and I'll share with you why in a second, what we'll do to kind of assess and kind of feed. I'll look at the hips first with the thoracic spine, the scapula, so our three-dimensional kind of pendulum swing matrix here. And you've seen me do these before. We'll then go in the frontal plane, and then we'll go in the transverse plane, just to kind of grossly see how things are kind of occurring, how they're kind of shaping out from a global perspective. And then I'll go into my LXX and my RXX stances, and I'll start doing just kind of some single arm pendulum swings, and I'll start to add some rotation with it to see how kind of the hip is affected with my swings, because I know that when I get this anterior, so if I'm going after this anterior and this kind of this posterior tilt with this up glide and with this down glide right here, some things that I want to kind of take a look at and kind of use to my advantage are the hip. So with that, my hip, as I go into shoulder extension and the hip flexion here and kind of explode and swing out of that with some extension or extending of the right hip, my shoulder's going into flexion. So we can take a look at how they're, in a sense, kind of affecting each other, kind of feeding off of each other. So I'll take a look at, again, kind of this sagittal plane, kind of LXX, RXX stance for my swings. I'll also then, with a single arm kind of pendulum swing, I'll go, if I'm looking at some frontal plane type motion, so some adduction at the shoulder joint with some internal rotation here. I'll take a look at loading up the left hip, the opposite hip, into some adduction to, as I swing it away, into abduction and kind of some upward rotation, some opposite hip abduction, some same side hip adduction. And then I can add a little motion to it. So I'm driving the abduction of the left hip as I come across with some abduction of the right arm. I'll go with some, I'll sequence, so if I'm looking at the right side yet, and treating, and then also getting in my preventative and performance and hand space type sections. My right foot, so it's this transverse plane kind of lunge with this transverse plane pendulum swing. So with the internal rotation, the horizontal kind of adduction, I am sequencing it with this external hip rotation. and this opposite hip internal rotation, so that, or contralateral, so that when I come on back, I'm sequencing the external rotation and the medial glide of the scapula with the right hip internal rotation. I'll then, with some of these patterns, I'll go into these single leg toe touchdowns, and I'll start kind of firing away with body weight, and I have these little squishy med balls. So if you get good enough, so what we'll do, and we could take advantage of loading up the hips, the trunk, the scapula with both of these guys as well. So I'll start off, so some simple stuff I'll start off with the single leg toe touchdown, a 70-30 weight split, opposite arm, opposite leg, flexion to extension, or extension to flexion of the shoulder, and flexion to extension of the hip. Again, so we can get set in a lunge position, or I'll go into my single leg toe touchdowns. I'll then add maybe a little in sync kind of upper extremity driver to load this back hip and internal rotation, but to drive some right rotation and right side bend of the scapula to draw, or thoracic spine, to get more external rotation of the scapula. I can also add a little frontal plane kind of driver right here with my left arm, or a little pendy swing here. If I wanted to, kind of like in this frontal plane now, again, if I load this kind of this adduction, this internal rotation with this opposite side hip adduction and flexion, I could get extension of this hip and abduction with abduction and potentially even some external rotation here, so I can start to hybrid these guys. Boom, boom. I go with a little hybrid of sagittal, of frontal, and transverse. So loadability of the butt and the hip is going to drive loadability, thoracic spine, scapulothoracic, as well as the shoulder. And then if I want to go a little bit more true, kind of transverse plane, I can go with a row and a press with my left arm as I'm driving internal and external rotation. I get some cervical spine mobs going as well. What I will then do, I'll also go to same side leg. So we can go to same side leg if I wanted to, maybe with extension and flexion, kind of load up that kind of sequence a little bit more. It'll kind of can help us drive some more extension with the right hip and the right shoulder flexion as well. So I'll boom. So to load that right butt up a little more, I'll go with my extension of the shoulder. I'll drive out of sync to load up that butt and hip, and the transverse plane to drive more shoulder extension and to help load better shoulder flexion, I should say, and right hip flexion with right shoulder extension. And then I can feed in with the frontal plane too. So I can load the hip flexion and adduction with the shoulder extension to give me better shoulder flexion up and overhead, which can help with that posterior tilt, the upward rotation, etc., etc. And then I can also hybrid them. As I'm swinging down back, I can rotate and go on the side-to-side angle. So now I get all three. I can also, in the side-to-side plane here, if I decide to, so in the frontal plane, let's say I want to establish a little bit more upward rotation, a little more of the scapula, a little downward rotation, a little medial lateral kind of glide. And if I want to include kind of the hip a little bit, so I can take the butt out on some planes and then take it in on some others, I'll go so far as like with my rotation right here, I'll go internal rotation of the hip and external rotation of the shoulder, and I'll explode out of it. So here and here, here and here. So work on kind of disassociating the two. Boom, and boom, boom, and boom. And I can add a little more frontal plane here. A little more frontal plane. And I can add a hybrid of both of those, the side to side, as well as the rotation with the rotation. So we just covered kind of the side to side, the frontal plane, as well as the transverse plane. With those, if I want to go a little bit more pure, kind of side to side. Showed you a little bit ago in terms of the lunges, what I would do, kind of like with the lunge, the lateral lunge, or the opposite side, kind of frontal plane lunge, the medial lunge right there. We can always go in with kind of like a little abduction and swing back into adduction to give us abduction of the shoulder. So it'll take the butt out of it a little bit in that frontal plane, but nonetheless give us a great load so we can get almost this type 1 in sync going. And we can add a little more, maybe a little more transverse plane as well. So as I rotate, or as I kind of swing down, my left arm can rotate out. Take advantage of a little more of that rotational plane load. Thoracic spine matrix. We have about 10 or 12 episodes up. I will make sure that they're able to do their type 1 out of sync, type 1 in sync, type 2 out of sync, and type 2 in sync. Those are a must. We have to be able to do those. Make sure with our 3D pivot lunge matrix, we're able to do our shoulder to overhead presses, which you can find. So we have our sagittal plane lunge, our common shoulder to overhead, sagittal plane, frontal plane here, transverse plane, and then we have our uncommon shoulder to overhead presses, again, which is going to hit all these combination of transformational zones. We'll then do them with our frontal plane lunge, all 6 patterns. We'll do that with the pivot, the opposite side frontal plane lunge, and for the sagittal plane we're here and we're here when we're loading back and into the butt. And then we're also doing these 6 pressing patterns with our transverse plane lunges. Boom, and I'm just showing you a couple, just very basic. We'll also go uncommon with the lunges, and that will go anterior lateral for these presses to posterior medial, and we'll go anterior medial to a different form of the posterior lateral, or boom to boom, and then we also have that one right there.